Learn how a transplant data analyst from the University of California, San Diego applies anthropology to qualitative analysis in health research. Let's meet Josh Liggett, applied anthropologist and transplant data analyst.
My name is Joshua Liggett. I am a multi-ethnic gay male with short, dark brown hair, hazel eyes, wearing a dark teal button-down shirt, and a Progress LGBTQ flag pin. My background image is that of UCSD San Diego's California Notify program.
How did you get into anthropology, and what is your subfield of practice?
Well, this is actually kind of a funny story. I am a bit of a Trekkie. And so growing up, my childhood here was Jean-Luc Picard, captain of the Enterprise D and E, respectively. In the show, he's portrayed as a physicist and an anthropologist. I did try my hand at physics, did not do spectacularly, and discovered I am a better anthropologist.
How has the anthropological perspective or training enhanced your contribution to your workplace?
It's really helped me be a better chameleon and transition from industry to industry. My first real job was in behavioral health. And then from there, I took a job assessing LGBT communities in the Central Valley, which is not necessarily known for being a pro-gay area of California.
Tell me a moment that changed the way you practiced anthropology.
It was definitely a period of growth rather than even just a singular moment. Coming to terms with the idea that, I wasn't necessarily going to be, studying some population in some historical practice of anthropology, but being an anthropologist, studying things that solve real problems for real people, that's anthropology, and so I can take that with me wherever I go. Wherever I go, whatever I do, I can make it anthropology.
What types of industry challenges or problems do you get to help solve with this anthropological lens?
I like to and I get to solve a lot of problems around how to improve transplant services for our population of patients and also for our staff, being able to work with frontline staff to make sure that whatever they're doing in their day-to-day, they are feeling fulfilled by it, and it's fulfilling the needs of the patients. And so we're able to address so many factors and have a robust program that's helping many people every year.
What anthropological skills do you use in your field?
So a lot of my work so far has been around process improvement, performance improvement, and as we're getting out of the regularly putting out fires mode, we're able to do things that are more interesting, like what can we do earlier on in the process of identifying patients for transplants, and different identifiers that could indicate that they need different supports as they go through to make sure that they live longer and their graft stays around longer working for them. One of the tools, rather, that we currently use is called the 5 whys, where you just basically progressively ask, why is this a problem, but why is that a problem, until you get to the root cause of an issue.
What is the one thing about anthropology that nobody told you as a student?
Well, we heard a lot about anthropologists. Anthropologists can do anything, but not how. So one of the things that was really helpful is and almost like a bird course, being an anthropologist, was things like the Six Sigma lean training and so forth. And that's a big deal for my position now. And I can take the things that I learned in anthropology and slap a new name on it that, the folks in the transplant world are familiar with. And I'm still doing anthropology. I'm doing what I was trained to do. It has a different name now.
What message would you like to pass on to future practicing applied anthropologists?
I would say probably gaining rapport. That's something that starts as early as the job interview. When I applied for my first position, the folks were really interested in, the fact that I was an anthropologist and kind of in kinder words, what was I doing there? And, keying into different aspects of the interviewers, gave me a little bit of a leg up, identifying ways that I could interact with them and meet them on the same level. And, following through to my current role, I applied for this position. Technically, I applied for the liver program version of my position. I lost out to my colleague, who is actually, she's amazing at her job. So she definitely deserved it. But I made such a good impression in that interview that when the kidney program had their quality analyst position open up, my now boss reached out to me and said, "You should go apply for this now."
What advice would you like to pass on to future anthropologists seeking roles in professional fields?
Definitely find out the similarities between the field that you're interested in and anthropology, so that you can translate the skills that you have and the abilities that you've gained through your anthropological training into something that makes sense to the community you're trying to work with. So, with quality roles, Lean Six Sigma was the language. Healthcare, there's quite a language all unto itself. But as long as you're able to key into the similarities between us and everywhere else we can work, that's going to be the important thing.
Thank you, Josh Liggett, for sharing your experience as a practicing anthropologist. For more SNAPAshots, find us here, practicinganthropology.org, LinkedIn, Twitter, and Meta. Tune in next time for more SNAPAshots.